In India, we are going to work in two cities, one towards the eastern coast, Bhubaneswar, with a very high humidity along with high heat, and in a state called Rajasthan, which is on the western parts of the country, very high heat above 50 Celsius, almost bordering on 55 Celsius at times, the only state in the country with a desert. So there's going to be two very distinct but challenging situations, and we shall work with urban low-income settlements, and we have identified in a proposal urban low-income communities as a particularly vulnerable one in the context of heat health. Environmental health is beginning to get recognized as a priority, as a necessity within the broader rubric of public health. Public health per se getting into pretty large engagements with environmental health and particularly heat health in general is only beginning to happen now. Fortunately, this also coincides with a new programmatic initiative on the part of the federal government and also taken up by the state governments on heat-related health conditions and health illnesses. And I think we are there at the right time, and we shall be able to make meaningful impact. This project is about winds of change. We hope to build a broad-based multi-constituency coalition because heat affects everyone, but in somewhat different ways. The project is about designing interventions based on the findings of the formative phase and then co-creating with communities and then testing it out and look for its uptake in the formal systems. So the main goals is to identify interventions across four pillars: regulatory, health services, infrastructural, and behavioral. We will apply a set of tools and techniques drawing upon the behavioral economics elements to understand both economic advantages and to identify which interventions will be cost effective and therefore more likely or amenable to scaling up.